You are now listening to Protecting Your Nest with board-certified family medicine and obesity medicine specialist Dr. Tony Hampton. For more, visit drtonyhampton.com. Welcome to the Protecting Your Nest podcast. Lately, I've been spending more and more time thinking of ways to help my patients who are struggling to adopt lifestyle changes that have helped so many of my other patients achieve their health-related goals. I've learned that we all have similar goals to be healthy for ourselves and for the ones we love. Today, I want to introduce you to someone whose mission is to help support us along our journey by providing resources to support us as we journey towards metabolic health. Today's guest is Ambrish Sharma. Ambrish is an entrepreneur, healthcare innovator, and informatist who is focused on health literacy, patient education, health equity, and patient engagement. He currently is the Senior Informatics Research Manager with Oregon Clinical and Translational Research Institute and co-founder of MedAugeo, and I hope you'll help me pronounce that better, and is passionate about digital patient education and engagement. Ambrish has a background in healthcare, medicine, and medical informatics, all which support his interest in facilitating positive patient and population health outcomes. His past accomplishments include leading the successful implementation of a population health tool at community health centers across the state of Utah, designing and implementing various tools, processes, and policies to support healthcare initiatives in large and small academic settings, and project management in health IT. I wanted Ambrish to come to the podcast to share some of the innovations he feels will help us overcome the struggles that have prevented so many from achieving metabolic health. That's his vision. That's my vision. And I know many of you want the same for your family and yourself. So why am I happy to have Ambrish here? Because he is exactly what the world needs as we continue to try to protect the nest of our friends and family. So Ambrish, with that, I welcome you to the Protecting Your Nest podcast.
Thank you, Dr. Hampton. It's great to be here. Thank you for the opportunity and to talk to your audience. And it's wonderful being here. And I that was that introduction went overboard. So, but
yeah,
thank you.
You earned it. And I really think it's important that our audience understands who's speaking to them. And when you have a background, as diverse as yours, in healthcare, entrepreneur, and informatics, I think that's important. And it'll actually lay the foundation for what we talk about today. So I'm definitely excited. And I know when I've done things in my health system, we're very lean oriented, which is the Toyota model. And through that model, we've learned that we learn a ton from people who are not doctors, not pharmacists, but engineers and others who have a different way of looking at healthcare. So I really appreciate all the work you're doing as we all try to, do a better job delivering excellent healthcare and transitioning to, from management to maintenance to healing. So anyway, so I've learned, over the years that many people, who find themselves, on a path to success have a partner in crime. They have a significant other, right, who supports them on their journey. So let's start with your story of how you met your wife and talk a little bit about the role she currently plays in helping you to support those who are trying to achieve metabolic health.
Well, I'm glad that she's not here. But, no, in all seriousness, I and Pooja, we've known each other for 20 years, but we've been married 18 years.
Cool.
We initially met through our families, as is customary in South Asian, East Indian cultures. But let me tell you, I had to earn it. So I had to, basically, to get her married with her, I had to earn that. but she has been very supportive throughout our journey together. She's also the inspiration behind not only my career in the traditional sense, but also behind MedAugeo. And with me, she shares the passion for improving healthcare for others. We're both first generation immigrants, so we've seen firsthand some of the challenges that folks may encounter as a result of that. Um, and she's more on the technical side. She has a teaching background as well, so
Mm-hmm.
she brings a lot to the table. And she really supports Medageo's efforts towards serving patients in terms of her expertise in IT as well as data and analytics. So that's we're glad that she's there, and then we are a woman led and organization. So most of our team members, or we like to call them family members, are women.
Mm-hmm.
So it's not only a woman owned but also a women led organization. So um, yeah, but it's been great journey with Pooja.
Yeah. Well, it's funny as I definitely understand the importance of having strong women lead us. And, I literally, a few weeks ago, maybe a month or so ago, we saw The Woman King. And in that woman, you had all of these strong women portrayed in that. And I just think that's really, I just love that, man. I've always been surrounded. I had a single mom raising me. So, had a chance to see what a strong woman looks like. And I really like the fact that your hobby is like mine in a way. Your hobby is helping people to be healthier, slightly different than, so MedAugeo is doing that. And then my podcast and my YouTube channel is my hobby, and it's doing the same thing. So it's not exactly our day jobs, but I'm happy that your hobby is going to impact lives. So I really appreciate that. And, when I did your intro, I talked a little bit about having so many expertise in multiple areas. So, what led you to having such a diverse background, and how do you plan to use it to help the people out there who need to have a path to healing?
I'm glad you asked that. And sometimes, we lose track of time. And then, as somebody I recently saw, like I think on LinkedIn, and somebody had mentioned, like, they were looking at their profile and it hits you, like, oh my God, like my own journey, right? So I kind of started my journey in healthcare in a joint MD MHA program. So I wanted to learn more about how our health care system works, both from the business side of things as well as like administrative side of things, as well as like the scientific, the patient care side of things. And then as I went through that, I realized that there was more that I wanted to achieve in terms of my ambition to help others. And I thought technology was the best route to do that, especially with increased focus on data and analytics and artificial intelligence. And I went back to school, completed another master's in informatics. And all of those amalgamated together have been really helpful for my career journey, as well as helping to basically get MedAugeo on its feet. So there's so much experience I have gathered, and then also the knowledge base helps you. So be it something as simple as creating content, being more empathetic when creating content for patients, focusing on different strategies for different groups, how that plays into something as simple as the social determinants of health or access to care. So all of that knowledge really helps me, and will continue to help me. So I'm very grateful to all that have facilitated those journeys for me.
Yeah, and the idea that you needed to go back to school to get some additional training resonates with me as I think about my master's in nutrition and functional medicine. And I think for all the adults who hear our voices, who have young people, remind people that school is cool, it's
Yes.
okay. It's okay. And I think what's cool about being an adult is that we can choose a little bit with even more clarity what we want to do with that education. For me, it was just being able to have intellectually stimulating conversations about nutrition and understanding the root cause of medicine. And for you, it was a different purpose. But I just think that school is cool. And then I think people just need to be thoughtful. So what I thought about was, why would I want to get some more education, right? And you have to really just think about it, make sure it's, return on investment. And I don't think I had to do it in order to stand before this, audience, but I think it's helpful so that as you're thinking about how to help people, you'll have a foundational knowledge. And when you're interacting with others, I'm sure as you guys are working on your business, you have to interact with people and you just want to have a level of expertise so that you can have conversations that add value. So I love all of that. So a lot of people who come to this podcast have, had some type of personal health challenge that they had to overcome. And before we talk about how you're going to hopefully improve the current healthcare model, talk a little bit about any struggles you've had or anything you want to share with the audience about that.
So, I was recently diagnosed as a type 2 diabetic, and I'm talking about less than 6 months ago. And, I started experiencing some of the symptoms, but I think one thing is fear that keeps us from going. And even though you may be aware of things, but that fear keeps you away. And then again, thanks to my wife that she really pushed me. And then, I found out my hemoglobin A1C level was a 9.5, which came as
Mm,
a huge shocker. I mean, I had noticed a few symptoms here and there, like, kind of delayed healing and things like that. But it really came as a shocker, and I was very down, with the way the message came across to me. My physician, kudos to him, he's a great guy, but still, it just I was shell shocked, to say the
mm-hmm,
least, and I almost was asked to go on medications. It was almost like a health emergency.
mm-hmm,
But I asked my provider to give me a few months to turn the situation around. I was confident I could do that. And then at that night, basically, I just stayed up and I had to really rethink my priorities in life and, basically implement a lot of changes. So mostly I worked on diet, and then I
mm-hmm,
also worked on exercise and other lifestyle changes, better sleep, and within a span of, I want to say 2 to 3 months, I went back, and fortunately, I'm still kind of in the red zone. I'm at a level 7, so but
mm-hmm,
still it's from 9.5 to 7, and I continue to adhere to those kind of guidelines that I implemented for myself, and so I'm still kind of writing that story, but at
mm-hmm.
least I'm, trying to overcome that. So I think that personally, and your podcast, it personally resonates with me, right? So
Mm-hmm.
it's amazing what you're doing, with for your audience and helping them, um, being aware of those methodologies that they can help to heal themselves.
And I appreciate that. Thank you for those words. And I think for all the clinicians out there who hear our voice, the guidelines actually tell us to do lifestyle first. So 9.5 is not an emergency. It's just a level that's shocking to the person.
Yes.
But for a person who starts the journey, and for us, it's all about carbs. So if you start the journey and you start to say, well, what can I reduce in my diet that's going to raise my blood sugar? And it tends to be any graph. If anybody searches carb, protein, fat graph, right? And they'll see that the carbs are the ones that raise the blood sugar. So if we reduce that, you remove the toxin, the poison, and the need for medicine goes away. Now, going from 9.5 to 7 is a significant improvement. So you should be proud of that. And then you add exercise. So if you add muscle, you give the glycogen, which is how we store glucose, a place to be stored. So a little bit more muscle. I'm sure your wife don't mind that at all. And you got to be on a sleep schedule. And that does require your wife also to have a conversation. Let's be on a consistent sleep schedule. So for all the clinicians, please give your patients a chance to um, to do it with lifestyle. They deserve that. You deserve that. And sometimes you give the wrong message when you just go to medicine. The better message is to say, you have a choice. We can take the path of medication, or we can take the path of lifestyle. If we struggle with lifestyle, now there are levels that you really need to get on medicine, I would say. Certainly, maybe 10, 11, 12, 13. You may want to start off with a little something, in the water to help out. But I'm really proud of you that you took it upon yourself. So it's a team sport. It's not just having the right metabolically trained doctor in front of you. It's about patients saying, listen, what do I need to do to improve my health? So that's beautiful. So let's talk a little bit about the healthcare model. And we're always trying to continue. What I learned with the lean methodology from Toyota, Japan, is that we need to have a mindset of continuous improvement, right? So we're never satisfied, even when things are going well. Even if we had centers of metabolic excellence, which I'm hoping to have within my health system at some point, we're still going to have room to improve. How we deliver that care, how we engage people, all of those things. So let's talk a little bit about, from your perspective, what can we improve? What are you hoping to improve with our current model that is not really helping people to heal as well as we'd like?
I think there are, if I were to put the challenges, I think first of all that we have a great healthcare system in terms of its technological capability and the provider, the healthcare provider and staff population that we have, and really all that they do for the patients. But no system is perfect, and the challenges, according to me, I think lie in three buckets, if I may. Um, One is definitely cost, the prohibitive nature of the cost for most people. The other bucket I would probably put it as uneven access. So, as you're probably aware, the disparities that exist in health equity.
Mm-hmm.
And one kind of blind spot that we forget about is this focus on, as you kind of alluded to earlier, Dr. Hampton, this extreme focus on drugs and procedures rather than lifestyle and other modifications. Um, you know, I think there needs to be increased focus on primary care, and related to that, health awareness. By that I mean patient education and health literacy, because you don't know what you don't know, right? So
Mm-hmm.
um, I think those are kind of like that lack of focus on preventive care and patient education is probably that third big, those are some of the challenges. And this is where we are trying to help, do our part with MedAugeo, in terms of educating the patients and creating content, meeting patients. We like to say in our family, by that I mean the MedAugeo family, we like to meet patients where they are. So we don't create content that's this infographic,
Mm-hmm.
that was created and is at such a high level and has such a disconnect with patients. That as a patient, once you walk out of the door, you just toss that in the
Right.
trash bin, right? So we try to create very interactive
Mm-hmm.
content, and that's how we try to reach and do our part in that awareness, as well as trying to be more on the preventive side of things.
I want to give my audience a visual of MedAugeo, and so if you could just describe how that content will be, delivered to that person who needs it. So just give a little bit more so they'll understand exactly what you're talking about.
So we have multiple modalities through which we can we work with healthcare systems as partners, our customers, and then we create content that's data driven. So we always, look at the data first and talk over the pain points, and we customize that content for the patient population in these health systems. And then we basically create very, very targeted and customized content in multiple languages, even multiple dialects and accents, so to say.
Hmm.
So it really can align with the patient. And then we basically give the health system the means to deliver that content, be it over email or text
Mhm.
message or other means. We have automated workflows. So we try to favor automation, so it's the least burdensome on the health system to push this content to the patients. And then we're always studying the data to kind of improve our not only the quality of our content, but the methodologies and the delivery and all that. So
All right, cool. So that's very helpful. We actually, for those who are checking us out, we did a video short entitled "The Many Reasons Why We Struggle to Achieve Our Health-Related Goals." And one of the things that, we touch on is the social determinants of health. So when I think about struggle, I think about my nest and my rope. I think about and the components of it. I think about social determinants of health. So where do you think social determinants of health fit into this equation? Because it's one thing to kind of, know what the you know, to understand how to convey good information. So I'm all about, carb restriction. So I want to convey that message, but then people may struggle to do it, right? And we know the social determinants of health, finance and, access, which is what you've mentioned, and other factors, the environment hinder us. So is that part of what you guys are going to touch on as you try to help the health systems to, reach their patients?
yeah, I'm glad you asked that because we include the social determinants of health in most of our content, given the context of the content. So we want to create a holistic system of health. So rather than this machinistic view of the human body and just physiology and the physical aspects of things, so we know that there is much more, as you said, Dr. Hampton, that impacts our lives and our health in turn. So we always have a social determinants of health angle built into the content, and it's contextual. So I mean, it depends on who the population is that we're trying to create content for. But then there's also in-house content that we create, and that's where we focus. So we have content in different languages and very hard to reach populations, and populations that most it's not on the radar for larger systems, and just trying to reach those groups. We do research, like for example, in Utah, in southern Utah, there is a program to help. It's a food prescription program essentially to help families who are struggling. Just paying for healthy food. So what the program is the provider, once the patient meets the certain criteria like income and other factors, the provider can actually write a prescription for health foods, and they can buy at local grocery stores which source all the products and the produce from local farms. So
Mm.
it's almost like an ecosystem
Hmm.
that they've created. So when we created patient content for um, this group of patients, we've mentioned references and how they can access those programs, or where those stores may be, or how they can get in touch with this health system, for example. Then there is, there's so many. I mean, health, social determinants of health really drives and will continue to drive, improving health outcomes and fighting those challenges that we spoke about. One of the things I always think about is how providers can basically they need to go further. There needs to be, first of all, more training of providers and patients, and more education about what social determinants of health are, what the different ones are. And for something as simple as a person experiencing houselessness, I purposely don't like to use the word homelessness because home
Hmm.
has that that personal connotation. So somebody who may not have a temporary residence, you know, expecting them to adhere to their medication for hypertension or diabetes. For example, if I'm struggling to have a roof on my head, the last thing I probably would be concerned about is getting my meds refilled. And maybe I think as a patient that I can, kind of kick the can down the road, and once things stabilize, I can get the meds, or choosing to put food on the table for the family versus having my prescription refilled. Those are very, very important things, both from patients and as providers, as health systems, pretty much as a society. If we don't recognize those, I think we're doing a great injustice. So I think that the social determinants of health really, I like to call them social drivers of health. They really drive this equation.
I like drivers of health. That's well stated. And it's so logical if you want to get the results. If the goal is to help the person in front of you achieve their goals, then wouldn't it make sense to think about the barriers first, right? Because if you don't address the barriers, then how are they going to be successful? It's just so I just think that, and we've all been trained to, you know, just figure out what the diagnosis is. And if we do that well, we've been patted on the back in the past. That's how we were trained. The smartest doctor in the room was applauded, and it didn't really matter necessarily how he talked to the patient or she. It didn't really matter necessarily that that person couldn't afford the medicine that they prescribed. All that matters is that they nailed it. They nailed the diagnosis. So we cheered and celebrated. And that's why some clinicians don't value what you're saying. But if they're trying to get the outcome, which is a person in front of them who has access to what you're prescribing, then they have to think about the barriers. So I hope that the beautiful thing is that health systems kind of know this, but they need guys like you and gals like your wife to create a way to make this all come to fruition. So and one of the other barriers is, you've mentioned that there are going to be different languages and things like that. So how important have you guys made it to make sure that the messages are done in a way that the person who has a third grade education understands it, and the guy who has, all the training we have understand it? So how are you guys managing that part?
Well, we always favor very simple, plain language, which is basically language that's spoken in our living rooms. This is language that people can understand on the streets, and where we like to meet patients where they are. So rather than have this paternalistic top-down approach, this is your disease, and
Hmm.
this. We like to create content in a language that's very easy to understand. We have a very diverse team, and a lot of us are first generation immigrants, or from those backgrounds that are considered traditionally disadvantaged,
Hmm.
for lack of better word. So we understand firsthand some of the challenges. Like, you have this large system. I'm just gonna pick randomly, like maybe in academia or what have you. This some of the brightest minds, and just trying to create content, but a lot of times the hindrance becomes that wisdom that comes from experience. So having gone through that experience yourself, having those insights in those cultures and those societies, and a lot of our team does have that. So it's a very personal mission to us, which helps us. So something as simple as certain populations respond well to like a storytelling comic book sort of methodology. I think there's a word. It's called photonovela
Hmm.
in South America, and there's a lot of research that's been done by government agencies all across the world and the World Health Organization, which proves the effectiveness of those. So, we kind of decide like what the population base is that we are serving, and then we either go with, maybe we need more interactive things, maybe we need infographic, maybe we need a photo novella. And so we really approach the problem from multiple angles, to basically create content that's easy to understand for the majority of people.
Thank you for doing that. And even as I think about um, something that's true to my heart, so my functional medicine training reminds me to not just stick with the standard traditional approaches, but to be flexible. And that flexibility will then want me to think about alternative approaches, complementary approaches to traditional medicine, which it could be a little bit of a barrier in the conventional allopathic model, because that may not be a standard in every health system that you would interact with. So, does your model also keep in mind, suggest, recommend integrative, holistic approaches as well?
Most definitely. This was one of the first things that we wanted to be cognizant of. And so we wanted to include, especially with the World Health Organization's new Center of Traditional and Complementary and Integrative Medicine that's been established. So, we are cognizant of like the increased focus, the increased patient interest in those, and really the effectiveness of those models. So, from a personal perspective, I'm a strong believer in Ayurveda and the ancient science of Ayurveda, and there's a lot of things that I incorporated, like as I was trying to traverse this journey of improving my hemoglobin A1C levels. Um, I took things from Ayurveda, and so we do have plans to you know include content from TCIM methodologies, be as simple as yoga, but we want to favor evidence based. So we always are in favor of evidence based, and so um, we have to do a lot of background research to find
Mhm.
a material, and then based on that we create content. But yes, we will be including TCIM practices.
I'm really excited that you said evidence-based, and let me tell you what I learned from University of Western States Nutrition and Functional Medicine's master's program. There definitely is evidence for a lot of modalities that are not traditional. But you just got to be careful. You have to kind of look
Yeah.
at what's there and always have a caution eye. But the good news is there's a ton of evidence out there for a lot of modalities. But I agree with you. If we're going to talk to the patient who's taking the time to look up things, if we're going to talk to health systems that then need to convince their payers, that this is something that's valuable, that we should support, it's got to be evidence based. Now, you could argue the current research model is not perfect, because can you use the exact same model for the complementary world? Maybe, maybe not. I would argue it needs to be modified a little bit. But beyond that, I think you're right. If I'm going to speak to my colleagues, I need to show them legitimate science to support any ideas that I have. So I think that's the right thing to do. So please continue to do that. As we continue to think about why people struggle, one of the things that we've done in our health system is, in fact, our leader for community health. Her name is Jackie Rouse, and she is doing a great job. And the fact that we even have a person who's a leader in community health is already a win, right? But one of the things that we've done as we try to bridge what we're doing with the community we serve is that we engage community health workers. Now, community health workers are great because they tend to live in the neighborhoods where Miss Jones, who I'm trying to engage, lives, and she can, really more closely speak the language of that person in terms of culture and other factors. So what's been your experience with dealing with community health workers, and is that part of the model that you guys are trying to create?
Um, I'm It's interesting that you mentioned that because my own experience, I worked as a community health specialist.
Oh, did
Really,
you?
the literally like the boots on the ground, you know. So I worked
Yes.
in inner city Chicago with a very diverse population base,
Really?
and my
In my
primary role,
hometown? I didn't know. That's
yes.
awesome. I did not know that. That's crazy.
So I worked mostly in Southside Chicago as well as some of the western suburbs.
Wow.
Um, and you really get to see firsthand the challenges, for example, the disparities, and in different neighborhoods within the same city. It's just it's mind-boggling. But I learned so much from that experience, and I'm so thankful for that because there were so many people I was able to reconnect with their healthcare. I worked more both in an academic setting in community health as well as FQHC, federally qualified healthcare center setting, and it was just like so thankful that somebody would, just because you showed up, somebody is going to
Mm.
now go see and get their blood sugar checked, which they should have done like 9 months ago. So you have I have nothing but respect for community health workers and the whole program and how it helps people stay engaged. We're kind of like a digital uh, I want to say a partner to community health specialists.
Mhm.
So things that, for example, that they may not be able to cover in a visit, they can
Mhm.
easily, using MedAugeo, they can message that to the patient, or so we are more of a working synergistically with them, like a potentiator to their work. And yeah, I've so much respect for community health workers. It's an amazing program.
Well, you definitely got my vote. You're in my backyard. So I didn't know that, and I'm really excited about that. And I think what I've learned, rather we're talking about politics or health systems, just show up. If people just show up and show the world and a community that they care about them, I think that that's important. Just let them know that you care, right? And I just think that that's amazing. And I was going to ask you about, how you plan to, because a lot of communities of color are the ones who are disproportionately impacted by, not having the resources that lead to struggles around social determinants of health. African Americans, Latin Americans, Asian Americans, Native Americans. I've had all of those groups. Actually, I don't. Yeah, I've had all of those groups on my podcast. Um, and typically, when we have those groups of guests on the podcast, they will speak to some issues around the struggle. So it sounds like you're going to do a good job in terms of language and other issues. But man, if you are also, with your background, going to have this vision and you can advise the health systems about the value of kind of on the ground boots, community health workers approach. I mean, that's really a slam dunk in terms of high, greatly increasing the potential that the approach that you have is going to work. So my assumption is that because you have this background, you'll be able to more clearly understand how to speak to these different groups of people.
Yeah, I mean, that experience, I cherish it. I learned so much from it, how certain populations respond to certain modalities versus, you can be sitting up in high ivory towers and creating this content and, maybe in, for example, Spanish, and you think like, oh, why are the patients not responding? And it's just maybe you have to go into like the finer details and be aware of those insights and culture, and this is where we have a great team, who's experienced this firsthand, and so they really know how to go that extra mile. Just translating into a different language will get you some ways, but then there are these cultural nuances that really will uh, make that journey successful.
Yeah, I can tell you, I literally just had a conversation 2 days before this recording, and, I had a Mexican team member, a Puerto Rican team member, and they were making fun of me as I was trying to say something in Spanish, you know? But then I said, "Hey, my oldest son has his own podcast called Ritmos Negros." That's Brandon Hampton. He's doing really well with that. He sends out an episode every month, but it's in English, and then there's a version in Spanish. So I had them listen to him, and when they listened to him, they were like listening. I was like, wait a minute, he sounds like his Spanish is more Cuban, and I was like, what do you mean? Is it just Spanish? It's like they was like, no, there's nuance within each culture, even within their own culture. And they started giving examples of words that meant the same thing, but they were completely different. I was like, whoa, I'm just trying to, I just want to learn some basic Spanish. So I think you're right. And I think people maybe, may not be as engaged if you don't understand this. So I think that's awesome. One of the things I also want to mention, because I was asking you about how this information is going to be delivered. Obviously I have a YouTube channel. So my thought, and the reason why I started the YouTube channel, I would literally have a person in front of me, and a lot of times it was the older patients, so they'd be 65 and up. Let's just put that down. It's out of old age for those who are listening, just as an example. And I would say, okay, here's the podcast app on Apple or Spotify. I would find it. I would subscribe them to my podcast. And, I see them 3 or 6 months later and they're like, haven't touched it, right? But what I
Yeah.
found is that people, they tend to like YouTube more. So with YouTube, they respond to that. So that's one of the reasons why I felt it was necessary to transition this podcast to YouTube, and now I'm also trying to make smaller videos. But so, what's your thoughts on, this idea of using, video as a way to reach people? How important is that, or has that been for you?
So we create video content as well, and we're able to deliver it in a HIPAA compliant way. So I think, having worked in health IT for a while now, both I and my wife are very conscious about compliance and
Mhm.
security, cybersecurity. So we, from the get go, we wanted to build a solution that's compliant with the laws and regulations. So, and that was part of the challenge too, that it took us, because I mean, there are other ways that we could have delivered the content, but it probably would not have been, because we also, it's not only content that we create, we also offer analytics to our the partners that we work with, and then we also work kind of in a consulting role based on the data that we receive and all that. So to protect PHI and all that, we needed HIPAA compliance. But to answer your question, I mean, there are other ways that we are able to deliver the content. For example, if a person goes in clinic and they're waiting to see their provider, maybe in the waiting room, or as they wait in the actual examining room, they can watch our content. So,
Mhm.
and we're able to track those analytics as well. So, um, yeah, I'm sorry, I lost track of your original question, Dr.
No,
Hampton.
no, it's all good. In fact, it's kind of funny because as I'm hearing you talk, I'm like, okay, you do work in this video space. I'm making YouTube videos, so we'll be talking after the podcast about, let's see what we could do together. Because again, I'm whatever I can do to reach people. This is a life mission, and
Awesome.
and basically it was like, is the video platform a great way to reach more people? And I think it is. But I think how you do that may vary. Sometimes people like you because they like your approach, right? You have people who talk a certain way, have a certain personality. Sometimes it's how it's delivered. Some people are very visual. So I just think having multiple ways to get the message across is the key. But it's just a question of your thoughts on, do you think that platform is going to be very important as you guys proceed moving forward?
Yeah, I think, YouTube and some of its other parallel systems are they're amazing in in terms of their ability to reach people. And I think you've caught the right wave in terms of, fulfilling your passions and helping people. It's down the road. We can definitely, we're open to using YouTube. I mean, we would love to work with you, but besides that, in other contexts, we are definitely open to looking at YouTube and all that. I think we will be more effective and able to help at an individual level when we actually work with the data and analytics, and then that informs, you know, so actual care for the patient, and getting them re-engaged. And
That's right.
so I think both modalities would be great for us in the future.
Yeah, I think information is so critical. So before I ask you about how you're going to protect your nest, I guess I want to kind of wrap up with a question about how your vision for the future. If you were to kind of describe a more ideal state in the next, 10 years for you, what types of things would you like to see happen? Just in general, or are you personally within the business you're trying to grow?
From my ambition to help others, I think um, we would like to be at a point where we are able to provide information um, to anyone based on their personal um, condition, and do it in a very secure and confidential and private way, respecting the privacy of the individual. Um, we want to, there's a lot. Unfortunately, there's a lot is said on the use of artificial intelligence and things like that. It's kind of become a buzzword. We do have
Yeah.
some of those elements, but we always want to be ethical
Mhm.
and upfront with our partners and the patients that we serve. But I think we want to be at a point where information is on your fingertips as a patient through our platform. And it's helpful. It'll help you make more robust and effective decisions in partnership with your provider, being led by a healthcare provider. And then we want to be that partner, that facilitator in improving your health outcomes.
That sounds great. Definitely hoping all of that comes to fruition. I really think the things you've shared today are key to helping people who struggle. So definitely encourage those who are watching this video to check out our brief video that we'll kind of put out around the same time. And we want to keep you around. So talk a little bit about how you plan to protect your nest over the next 12 months. What areas are you going to focus on? I know you're trying to completely reverse type 2 diabetes. I promise you that's going to happen. It's just a matter of time.
Yeah.
So what do you plan to do over the next 12 months to stay healthy?
Um, there was a point in our lives where I was doing a full-time internship. I was working full-time, and then so two full-time jobs, a full-time course load, as you probably are aware of the challenges of that,
Hmm.
going back to school, and then having a family. So we were averaging like 4 hours of sleep, and
Mm.
out of all those experiences, we've grown wiser. So, as I mentioned earlier, I've changed my nutrition, and I can, um, hope to, keep that journey going. And, I've really kind of incorporated those nutritional points. So it's not like a fad diet, it's not
Hmm.
like I'm not dieting for a few months and then well, I'm just going to go back to normal, right? So I've kind of tried to set a new normal. So, for example, something as simple as grains, right? Like, so instead
Mm-hmm.
of eating a traditional Indian food where, there's a flatbread, right, made of wheat, switching that over to maybe millets, or
Mm-hmm.
other grains with low glycemic
Mm-hmm.
indices. And so those are some of the points that I've incorporated nutrition wise. Um, in terms of sleep, I've learned not to, I like to have like now 6 to 8 hours of sleep. So sleep more, definitely focus on sleep. And then, and I've had to go back and kind of revisit my thinking process. I was one of these people who constantly what's the word? Like, was more like compulsive thinker,
Mm-hmm.
and a lot of it comes from worries and insecurities, sometimes not even founded or real. We all struggle with those, and so I've learned to be more mindful of my own thoughts, of my surroundings, of just general things in life, and those are some of the principles. And I you know meditation, I've started meditation, and I'm kind of dabbling with yoga as well. So those are things that are really helping me, and I think I'm just going to keep continuing going down that road.
It's a journey, and until we have our final day, we'll be trying to improve and get better. And I just think that you're on the right track. Again, the work that you and your wife are doing are critical, and I'm just so happy that you're on the planet trying to add value. So thank you for being here. And many people may want to learn more about your company. That it may have intrigued them. They may want to use your company. So talk a little bit about how people can reach out to you.
So they can reach out to us through our company email. So we are not the application, the solution we are doing is not live yet. We hope to launch in the first quarter of 2023, but we are about 90% done. We're going through more compliance testing and all. But they can reach out to me over the company email, which is, I'll type in chat. It's team@medaugeo.com. That's medaugeo.com. And then personally, they can reach out to me at ambrish.sharma@medaugeo.com. So we have kind of like just a static website for now, but there's another actual website that's under development. So it's coming up pretty soon.
All right, cool. I'll make sure both of those are um, in the show notes to the video and, of course, to the podcast that people will enjoy this episode in. So, again, thank you. I'm so happy that my Protecting Your Nest podcast is, diverse. It's not just the, low carb message only. It's about how do we help people achieve metabolic health. And as a reminder, guys, the nest and the rope are the aspects that will help you overcome the barriers that you struggle with. So the example of I'm struggling with my numbers, doctor. My sugars are high. Well, how much sleep are you getting? If you don't get enough sleep, your sugar is going to be high. So it's just those simple principles that we all need to learn. So I'm so happy that you are a guest today. And so thank you again, Ambrish, for just being here and all the work you're doing. And we will be working together, whether you know it or not. So talk to your wife and let her know. I'm going to talk to my wife and we're going to figure out a way to work together, my friend. So thank you again for being on the Protecting Your Nest podcast.
It's my pleasure and my honor. Thank you for the opportunity.
Thank you. So for those who came to this episode, thank you so much. You have learned, from today's episode that, it's going to take more than just a clinician or a health system to solve many of the health barriers that we face during our journey to achieve metabolic health. And, so the question is, what do we need? Well, we need the minds of innovative thought leaders like Ambrish, whose innovations, I think, will help remove many of the barriers so many of us will face along our way. So if you find yourself in a struggle, don't, just know that there are people out there, who hear you and who will find ways to help you overcome these struggles. So when that struggle occurs, don't give up, because help is just around the corner. So I really hope you enjoyed today's episode. I really did, and only ask that as you move towards your next day, you continue to be safe, be well, and continue to protect your nest. You've been listening to Protecting Your Nest with Dr. Tony Hampton. For more, visit drtonyhampton.com.